is an amazing time, but sometimes we can have some uncomfortable symptoms that go along with it. So today we're going to talk about lightning crotch and other common pelvic pains that we can have in pregnancy. We'll go through them, we'll describe them, and we'll give you some helpful tips of how you can improve them.
Welcome to the She Found Health podcast. We are Doctors Sarah and Alicia. We're maternity doctors who are passionate about caring for women and young families from conception through the first few challenging years of parenthood.
We have 5 kiddos between the two of us, so we get it. We've been there, and we made it through to the other side, and now we want to support you through your journey.
We are delving deep into topics to prepare you to have the healthiest pregnancy possible, the best birth you can, and to thrive rather than just survive during the newborn and postpartum phase.
We want to remind you that the information that we share is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information we share may not apply to every situation. If you have questions or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. So the first thing we're going to talk about is lightning crotch. This is exactly what it sounds like. It feels like when you have a bolt of lightning hitting your cervix. So it's usually coming up at the bottom of your eyes. Stop your breath. It goes away in a minute. And it's not baby is putting pressure on your cervix for some reason. Most of the nerves that are in our uterus are actually centered around our cervix. So when you're in labor, a lot of that pain is actually your cervix changing. So when your baby is punching your cervix or headbutting your cervix or kicking your cervix, that's what causes lightning crotch. So usually shifting to a different position can help with just getting that baby part off of your cervix and help improve the pain.
Another common symptom women experience is varicose veins of the vulva or the labia. So a lot of you are probably familiar with varicose veins on the legs, but unfortunately in pregnancy you can actually get these on the vulva themselves. So what happens and what causes this is that as your uterus grows, it starts to make it more difficult for the blood that's passing back up to your heart to pass through, because it's the veins aren't constricting and moving the blood forward. So the blood tends to pool and sort of overfill those blood vessels. And unfortunately, the blood vessels of the vulva are just one of the areas where this can happen. So if you've got varicose veins in your legs, oftentimes compression socks or compression stockings can be helpful. That doesn't necessarily help when you've got those varicose veins of the vulva and the labia. There are some products out there, and we can link to some below, that some of our patients and some of my friends have actually found moderately helpful.
And sometimes those full compression stockings, like the full-on nylon tights, can be helpful. So you can certainly try those. And again, we'll link below. And the symptom that this women often feel is more of a dull ache in their labia, as opposed to a sharp pain. It's a bit more of a, I was doing the punching again of the baby on your cervix. It's more of a dull ache that's kind of there, or it's a pressure sensation or kind of itchy. So just that kind of stretching and swelling sensation.
Yeah, and it would be good if you think that you do have this to ask your care provider to have a look, because we can simply have a look at the vulva and confirm that is what's going on and offer you some suggestions. And some women actually just find wearing tight bike shorts can be helpful. But it's something that is normal, is common. So if you're experiencing that sort of dull ache or itch, talk to your care provider. We can have a look and then give you some suggestions of what to try.
And generally, once you've delivered your baby and that pressure is off, these go away. Unlike the leg varicose veins that can stay with you a little bit more, the vulvar varicose veins generally tend to go away after you're done being pregnant. They'll probably come back the next pregnancy, but then they'll go away and not bother you once you're done being pregnant. So ligament pain. Ligament pain is extremely common in pregnancy. And if you're pregnant, you know that we don't grow at the same rate. We kind of have fits and spurts. So we'll grow and then we'll stay stable, and we'll grow and we'll stay stable again. The ligaments run from your hip bone to your pubic bone. And when you have a little bit of a growth spurt, it puts pressure on those ligaments, and they can be quite sore and tender for a few days. Most noticeable when you're shifting positions. So women lying in bed, often when they're going from one side to the other, will notice an increase in that pain. Or from when you're going from lying to sitting or sitting to standing, they'll notice an increase in that pain. This is very normal, and if you actually press on where the ligament inserts, so press right in front of your hip bone or right next to your pubic bone, you'll recreate the pain. And so we know that it is ligamentous pain. It is not worrisome. It is totally safe, and usually it settles down after a few days until your next growth spurt a week or two later. Some women find belly support bands extremely helpful. So again, we'll link to a couple of those below, just to take the pressure off of those ligaments. And this can often help back pain as well. So if you're suffering from back pain, lower back pain, those belly support bands can be very helpful for that as well.
So we want to know, what has been the most frustrating or annoying pain that you've experienced in pregnancy so far? Comment below, because if we're missing something, we can do another talk about this and make sure that we let people know what's normal, what's to be expected, and also so that you know that you're not alone in these pregnancy symptoms.
And if you have any tips or tricks, add them below. Because by no means do we know everything. And so if you have suggestions for other women out there, please help them out.
So another symptom women commonly experience is basically uterine growing pain. So as Dr. Alicia just said, our uterus doesn't sort of slowly, consistently grow over time. It kind of grows in almost fits and spurts here and there. So sometimes when you're going through a bit of a growth stage, you might experience some mild cramping or stretching sensation as your uterus grows. What's different from, concerning cramping is that these are not consistent or repetitive. They're just mild cramping that's here and there. So, if you're having a dull ache or dull cramping here and there, don't worry about that. This commonly happens as your uterus is growing.
All right, Braxton Hicks Contractions. Now, these are not contractions like we would typically say. They're generally not painful, but they can be very annoying and they can be quite frequent. Generally, they start after kind of 25 to 28-ish weeks. They happen more when you're active. So if you're out for a walk, you can get these tightening sensations, which can actually sometimes take your breath away. I know when I used to get them with my son, I had them from, 24, 25 weeks on. Anytime I would go out for walks or do any exercise or be up standing for a long time or be on call, I would get these tightening sensations, not painful, but they would actually, I'd have to catch my breath. Totally normal, not dangerous, as long as they're not shortening your cervix, which generally if they're not painful, they won't be. And if they go away when you rest, then you can be reassured that these are just normal Braxton Hicks contractions. Some women never experience them. Other women, like me, had them all the time. And I went post-dates and had to be induced with my son, so clearly. There you go. Clearly it wasn't doing anything to my cervix.
Yeah, and something I find is that women may not necessarily recognize them in a first pregnancy, but then subsequent pregnancies, they're more aware of them. And that's because it's like Dr. Alicia said, it's not painful, it's just a tightening. And then interesting tidbit is that if you want to know what it feels like, when you orgasm, your uterus contracts, but it's not painful. So if you have an orgasm while you're pregnant, you're going to get a hard, firm uterus that is not painful, and that's exactly what a Braxton Hicks would feel like.
Good pro tip.
Right?
There you
Thank
go.
you. So last symptom we're going to talk about today is gas pain. So progesterone is the progestation hormone. So you're going to have higher levels of it in your body throughout pregnancy than you do when you're non-pregnant. And what progesterone does is it causes the uterine muscle, all smooth muscle, to relax. Unfortunately, your bowel's made of mostly smooth muscle, so your bowels relax and slow down as well. So when things move more slowly, it tends to contribute to a sort of constellation of symptoms. So women often have acid reflux because the esophageal sphincter doesn't contract as smooth, gas and constipation. And let me tell you, gas pains can be really intense. You can get this sharp, sort of sudden cramping as your body's trying to move that hard stool through with minimal peristalsis. So gas pains can be totally normal. And, if you're not sure if it's a gas pain or not, please talk to your care provider. But things that you can do to minimize this would be water, drinking lots of water, getting activity, making sure you're moving your body, because believe it or not, moving your body actually helps move your bowels, and increasing the fiber content in your diet, whether that's just increasing, the amount of sort of greens and leafy vegetables that you're eating, but also if you're just increasing the amount of psyllium that's in your diet as well. And that can be done by purchasing, like psyllium husk or Metamucil or Benefiber. or even stool softeners. And the one that we most commonly recommend is called PEG 3350. That's the generic name. There's many brand names out there. Restoralax, Laxaday.
Yeah.
And that just draws water into your bowels, so you have to take a lot of water when you're taking these, but these can help your bowels move slowly and reduce the amount of gas pains that you're having.
The other thing is don't eat foods that naturally makes you gassy, because that'll just get worse in pregnancy. So if you've experienced these pains and you're wondering, oh my gosh, these things are horrible, how am I going to manage it with pregnancy, with delivery? Check out our birth plan below, because it has some great tips and tricks and how to start those conversations about pain management and how am I going to deal with that you can talk to your partner or your care provider with. So you can download it. We've put a link down below in the show notes for you. We'll also link to packing your bags. That's a good one. And we have a topic on preparing your perineum for delivery as well. So we'll link to those below if any of those sound interesting to you.
So thanks so much for watching. We hope that you found this useful. And if you enjoyed it, please make sure to like and subscribe to our channel for more great content. And make sure to check out the other great videos, which are part of our labor and delivery series. We'll link those below as well.
If you enjoyed listening, please head over to iTunes, subscribe so you don't miss any new episodes, and please leave us a review. If you found this helpful, take a screenshot and share on social to help other mamas access this information.
Check out our website at www.shefoundhealth.ca and join our community. We send out weekly emails and release new content focused on this incredible time in your lives. We'll also be sharing exclusive offers, so be sure not to miss out.